surviving 10 years of living with cancer. And I invite all of those people in that landmark to join me in ringing the bell. You have to get up. You have two choices. You can lie down and give up, or you get up. And if you get up, we're going to fight. Welcome back to Jack Ostro's Hope Podcast, Hold On to Positive Energy. Today's subject is cabozantinib. And cabozantinib is a very effective drug, but kind of pretty nasty drug. And I got to tell you all about it. But first, we'll just go through our routine of, again, advising that the content shared on the podcast reflects my personal journey and experience as a cancer patient. I'm not a medical professional, and nothing discussed in this podcast should be considered as medical advice. Always consult with your doctor or qualified health provider for guidance related to your health, diagnosis, or treatment option. Every person's medical situation is unique, and professional advice should be tailored to your individual needs. So, cabozantinib. So that is in Canada now considered to be, I believe, the second line of defense. This thing keeps moving as new medications are introduced. First line, second line, third line. In my world, this was the second line of defense. The immunotherapy, as you may recall, blew up on me big time. They have about a 97% success rate in terms of tolerance. I ended up being in the 3% group that had a tremendous response, over an excessive response to the immunotherapy in terms of my body having excessive inflammation. And that ended up in 4 months in the hospital. So actually kind of interesting because I don't remember any of this, by the way. And we were visiting cousins on the weekend, and she was describing the story of having the mask up to see me in ICU, and I was attached to all these tubes. And she's not the first person who's told me this. Pretty scary stuff. Fortunately, I slept through all of that. And I have no recollection of that whatsoever, which I guess is probably my body's defense mechanism, protecting me from the, how frightening that was for my wife and kids and family and friends. And but as I said, I don't recall any of it. I do recall everything about cabozantinib, however, and that was a bit of a challenge as well. And let me just explain. So firstly, cabozantinib is indicated treatment for advanced renal cell carcinoma. And again, depending on, when it was either considered a first or second line defense. It comes in pill form. And the protocol is that you start at a very high level. And what they're hoping to do is get the best result for you and see what you can tolerate. Now, at the very highest level, or thereabouts, I tolerated it for about 6 months. This was probably in 2021. And then the side effects started to kick in. So the side effects include risk of clots forming, causing heart attack, stroke, high blood pressure, hypertension, severe diarrhea. That was me. Loss of vision, headaches, confusion. The runs was a really major side effect for me. And I'm not talking just sort of average issue. I'm talking about a full day affair. I think my world record, in my little world was 13 events during the course of a day, which is just insane. The first 6 months were tolerable, but subsequent to that, the side effects became pronounced. One of the key side effects is fatigue, but when you add the runs to that as well, it sort of drains your body. And so it got to the point that I couldn't work. Here I was at that point, close to, 69, I think. So something like that. And I'm thinking, I was still working at that point. I'd like to continue working. I was enjoying the work. I've always enjoyed the work I do. The people are great. And, I like the challenge. But it got to be so bad that, I literally had to throw in the towel. I just could not function. And now, the way that, doctors deal with it is they started you off at the highest level, hoping that you can tolerate that for the longest time to get the best result for you possible. Fallback to that is when the side effects become intolerable, they start reducing the dosage. And it helps a bit, but then your body ultimately can't handle it and they've got to reduce again. So it's a series of reductions over a period of time. And so about 6 months in, I just about had the biscuit and called my insurance company and asked them, told them I literally can't work and what disability do I have? And it turned out I have a disability that only goes to age 71. So I was basically, able to, stop work and go on disability, which gives you an income, which is, we all need, income to support our families. But what was really troubling to me was that disability insurance stopped at 71. And I thought, geez, if anybody's going to need disability insurance, it'd probably be those that are 71 years and older. So just so that you're aware, there are other insurance policies, obviously more expensive policies that can carry you beyond 71. But it's interesting how they're designed. And in my case, that limited me to 2 years. Probably just as well in the sense that I could tolerate cabozanthine for the better part of 3 years. And at that point, it stopped being effective. So we saw some reductions in the first 6 months. We saw some steadiness, no increase of tumors. And, but this was a really nasty sort of couple of years. It just, not terrible, not a great way to live your life. But, in the moments that were tolerable, again, you could see your family, your friends, but it was tough, I must confess. That is a tougher medication. Again, thankfully, must thank our government again, because that there are medications that are covered by OHIP. The Trillium program exists to, so that, as we get to be seniors and, these are dire situations, the Trillium program there is doing the funding. And disability insurance, basically covered, I don't know if it was 2/3 of my income, I can't really recall, but that was fair. It was, it's a challenging process actually to go through. It's kind of, while you're in the midst of going through the cabozantinib and the side effects, you're now having to apply, first you have to ask your doctor to fill out forms that get presented, certainly qualified based on my situation. And then you've got to deal with the insurance company. And then I have an insurance agent who was outstanding and helped me navigate. And, so again, the importance of having advocates. And we'll talk about insurance in greater detail later on. But this was just a difficult time. Now, the good news is it kept me going for 3 years. And the reason that's good is, I wouldn't be here without it. Let's put it that way. It wasn't easy. The side effects to just, take away from the quality of your life. And that's not everybody is, so not everybody reacts the same way. This is the other thing I want to talk about is, this is not uncommon in terms of how I reacted, but some people have amazing results from Cabo. I've heard stories, people start on Cabo and somehow magically something disappears. And that's very rare. Same can be applicable for other drugs where, they start on the medication and all of a sudden, it works so well that the cancer disappears. And again, quite rare. On other occasions, much like I had the severe reaction to immunotherapy, other people have severe reactions to Cabo or some other medications. Hard to predict where you are. Most people have side effects. Most of the time it's fatigue in the runs, none of which is pleasant, but, listen, tolerable. Could still see friends, could still make the most of it. But that was one of the tougher medications that I had. The scan results, supported staying on it. And even after the 3 years were over, and we're looking at another medication, it's a time to transition. Like at that point, at close to the 3-year mark, we're starting to see a leveling off, a lot of improvement. Maybe it's not working. Maybe it's time to transition. And so I sought a second opinion. Oh, and that's something I want to talk to you about as well, is when you're at the crossroads of decision making, and these are sometimes difficult decisions. I mean, and you should be discussing obviously with your oncologist, but I wanted a second opinion. I wanted to talk to another specialist, someone who's highly respected as same class, just different voice. And his opinion was go back on it at a very high level and get the most out of it, which I did. Managed to tolerate that for another 6 months, not sure how. So I had at least 3+ years of this cabozantinib. I didn't say it was easy, but it worked. It got me to the next medication, which has been a whole lot easier. So, persevere. Sometimes it isn't easy, but there is light at the end of the tunnel. This isn't the only medication they can be on. So what the doctors are trying to do is basically get the most out of this medication for you, hoping that you'll have the best, results with the least side effects, and hoping that you can tolerate it for, as long as it's working. This is not an easy, road to go sometimes. That was not, I've had more fun being on Cabo, but, what are your choices? That's the best medication available at the time. It's working. It's keeping the cancer from growing. Side effects are nasty, but it keeps you in the game. And I think that's really what it's all about. We're buying time here, people. I'm, in this game, I'm in bonus territory. I recognize that. My life expectancy was 5 years. So Cabo gave me 3 years that allowed me to be there for when the next medication got presented. It wasn't, medication I'm on now was not available when I started Cabo. So, when you think, perhaps the doors are closing and it's getting kind of dark, don't give up hope. There's lots of choices. There's different, there are other alternatives, and there are new meds coming. And that's another thing you should be doing research on. What is, what's out in the States, what's out in Europe. By the way, many countries have their own innovations, but in Canada, it's primarily the US that we look to. Cabo was first approved by the FDA. Typically takes about a couple of years before it's approved in Canada, which is unfortunate. And Doug Ford is, the Premier of Ontario, has been on TV and it says that Canada has, been lagging in terms of its performance of bringing or introducing, these approved FDA drugs for cancer patients. And so personally, I was really pleased to hear that he wanted that gap to be reduced, to cancer drugs being introduced more, quicker to the patients that needed it, which also makes a lot of sense because, the quicker these drugs are introduced, the less likelihood that you're going to have patients in hospitals, which are obviously very expensive. And there's always a possibility that these things work. I think we're getting closer and closer to medications that are going to be more effective and with the possibility of some really outstanding results. So, I call this the Hope Podcast because I don't want you to give up hope, because hope is all we have. And truly, over the course of the 10 years that I've been at this, it's been amazing that I'm, new medications have always popped up as it finished the Cabo. This next medication called Levantamine became available. And we'll talk about that in our next podcast. But don't give up hope. There are new things, there are alternatives. You never know how you're going to react to any medication. And so, persevere, hang in there, do the best that you can. Get up, move, help yourself. Get support of your friends, family. I didn't get through this alone. This has been a family effort all the way through. I had great friends as well. I'm appreciative to the doctors, the nurses, everybody. So this was a tough period of time. This was, I stopped working, which I had enjoyed. Aside from the monetary issues, it was a difficult few years, but I did come through on the other side. I'm still here to tell you about it. And so for those of you who are going through it, keep persevering. There is light at the end of the tunnel. Wish you all well. And don't forget, at the bottom, we will have pages that, will direct you to make donations to Princess Margaret Hospital Foundation for Cancer Research, as well as for Kidney Cancer Canada, again, research related. We are looking to help you. And we're looking for your support in helping yourself and your family and your friends. And once again, I thank everybody. Have a wonderful day.